So thank you for joining me today. This is a very important webinar. You have a chance to really have a significant impact on people's lives, your male patients specifically. The information I'm going to share with you today really can be life-changing and life-saving. And because a lot of what I'm going to teach you is not really well known throughout the health professional channels, I think that this is going to be very eye-opening for many of you. So let's get started. Nutritional medicine and prostate health. It's a very important subject for a lot of obvious reasons. In terms of references, if you click on that link below, you'll see my research review article that I published a few years ago. So unless otherwise indicated on the slides, the scientific citations that I'm quoting from or accessing and bringing the material forward to show you is from the published data, and you'll see all those references at the end of that review paper that I have that's published and uploaded at that site. So there are really 5 important applications of nutritional medicine in prostate health. First of all, you have the opportunity to help your patients prevent prostate enlargement from ever becoming clinically significant. Also, if they already have benign prostatic hyperplasia and it's just mild to moderate, then there's interventions I'm going to show you that can help to reverse it as a complementary measure. You're going to see steps here where you can use nutritional medicine to help prevent prostate cancer development. And you're going to see studies where they've used nutritional interventions to help in the complementary management of localized and metastatic prostate cancer with some very good success. And then also in males who are prostate cancer survivors have had their prostate gland removed when it was just localized prostate cancer, it still tends to come back in a significant number of cases, like within 5 to 7 years. So some of these interventions can be applied also in an attempt to help prevent the recurrence of cancer. So there's 5 major touch points here that really involve just about every single man as the years tick by. So in terms of benign prostatic hyperplasia, understanding why and how the prostate enlarges is important. So there are 2 sort of growth periods during puberty when the prostate develops or doubles in size because it's very sensitive to androgen hormones. Then there's a second growth phase of the prostate gland that begins after or around age 25, but it's very significant after the age of 40 in particular. So prostate enlargement or benign prostatic hyperplasia rarely begins before the age of 40, but more than half of men in their 60s and as many as 90% of men in their 70s and 80s have not only enlarged prostates, but clinically significant enlargement where they're having some lower urinary tract symptoms. So as the baby boomers age, it's predicted that we're going to have a skyrocketing of these moderate to severe lower urinary tract symptoms in men as they get older. And you are in a position as a primary healthcare practitioner, if you're listening in today, to help to prevent this from happening in a significant number of men. So you're probably familiar with the signs and symptoms of benign prostatic hyperplasia. Because the prostate's enlarged, it's squeezing the urethra. It's hard for urine to flow from the bladder into the urethra, so you have difficulty passing urine. The urine stream is weak. Men get up, a number of times through the night to have to urinate, and things can get very more advanced over time. The idea is to try to prevent this from happening or becoming a significant health problem, that's what I'm going to show you today. So just to recall what all of this looks like, you see that just below the bladder, and you have the prostate gland, and in cross section, so the urethra really goes right through the prostate gland, right? So the anterior and the posterior aspects of the prostate are surrounding the urethra. So if the prostate is enlarging with benign prostatic hyperplasia, then it starts to put pressure on the urethra. It becomes very hard to void the bladder. So notice that it's called benign prostatic hyperplasia, not benign prostatic hypertrophy. It's not that the cells of the prostate get larger, it's that there's a greater number of prostate cells. The cells are dividing too quickly. And if we can slow down the rate of cell division of prostate cells, we solve a whole lot of problems. We decrease benign prostatic hyperplasia and can reverse it to some degree. And also, when you slow down the rate of cell division, you decrease the risk of cancer. That's true of every tissue. So prostate cancer is a significant problem. Just a few things to highlight again, that the prostate gland makes and stores seminal fluid. You know where it's located. It surrounds the urethra. And when it gets enlarged, you have these symptoms of frequency and urgency of voiding the bladder. And you can even have ejaculation problems. So the prostate gland contests glandular cells, and it's these glandular cells in the prostate gland, it's when they mutate that those cells become cancer cells. And those glands within the prostate, those glandular cells, are under control, or they're very much influenced by androgen hormones in the body like testosterone and androstenedione and dihydrotestosterone, DHT. And as men get older, they convert more testosterone into the more dangerous form of testosterone, which is dihydrotestosterone, or DHT. So in terms of prostate enlargement, as we see as men get older, there's a significant incidence of both prostate enlargement and prostate cancer. And a major factor is that after age 40 in particular, the body starts to convert more testosterone into the dangerous type of testosterone, dihydrotestosterone, that causes the cells of the prostate to divide. When cells divide, they make more genetic mistakes. Not only is there enlargement, there's more genetic mistakes are being made. And then if there are genetic mistakes made and a cancer cell emerges, the DHT promotes those cancer cells to divide and multiply. So the tumor is now spreading within the prostate. And then if it goes beyond the prostate capsule, then you have metastatic prostate cancer. It's no longer localized. And metastatic prostate cancer is a nightmare. So you want to prevent that, and you want to diagnose it before it ever gets beyond the prostate capsule. And that's done by having regular PSA blood tests by your physician. You know, if they see the PSA rising, we'll look at the PSA numbers in a moment. But if it looks suspicious that the PSA is rising too quickly, or it's above 4 nanograms per milliliter, then you're a candidate for a prostate biopsy. Hopefully, what you want to try to do is avoid ever even being in that position. So when we look at prostate cancer, you know, in the United States, it's 1 in 8 men is diagnosed with this problem. It's the second leading cause of cancer death in men in the United States. You know, the average age of diagnosis is 66 years old, which is still fairly young in life. In Canada, the statistics are very similar. Prostate cancer is the third leading cause of cancer death because we have slightly higher colon cancer rates than the US, just slightly, but enough to put prostate cancer in third place. If all men stopped smoking, lung cancer, of course, is the leading cause of cancer death. So if lung cancer disappeared, then it would be, you know, colon cancer and prostate cancer would be the main cancers we'd have to deal with. And both of those are very much influenced by diet and lifestyle, as you're going to see. So every day, 11 men in Canada dies from prostate cancer. So it's part of your job, in my opinion, to help educate men, to teach them how to mitigate the risk using proper nutrition and lifestyle interventions so they never get into this situation in the first place. And the reason that we know this is possible is because published data over the years in the Journal of the National Cancer Institute has shown us on a number of occasions by some of the world's most leading epidemiologists and health professionals like Dolan Pito and Dr. Walter Willett of Harvard University, showing that 75% of prostate cancer is preventable through more prudent dietary and lifestyle measures. Now, we don't know what all those measures are, but we have a pretty good sense of what many of them are, and that's what I'm going to present to you today. What are the diet and lifestyle factors that very much affect the prostate gland in a way that can protect it against enlargement and cancer? And what are the things that tend to promote enlargement and promote prostate cancer? They sort of are an extension of each other. So there are hormonal factors that influence the prostate gland. There's no doubt about that. And there's age-related changes in hormones that really start to encourage the prostate gland to enlarge as we get older. And I'll show you how to mitigate that risk. But there are many exogenous influences on the prostate gland as well that come from outside of the body. or are affected by lifestyle. So just being overweight is a significant risk factor for prostate cancer because fat cells start to make more estrone hormone when fat cells get larger. And estrone influences the prostate gland by slowing down the breakdown of the dangerous testosterone known as dihydrotestosterone. So you have higher levels of DHT, and so the prostate cells are dividing even faster. Alcohol increases the risk. I'll show you the research on all of this in a moment. Eating foods with saturated fat and trans fat, pan frying foods, charring foods, these things all are strongly linked to increased risk of prostate cancer. Whereas all these other sort of protective nutrients that you see below there, from soy isoflavones to cruciferous vegetables and ground flaxseed and vitamin D and zinc, and all these things have a tremendous protective effect, as I will illustrate for you as we go through this presentation. I have to move pretty quickly to get all of this done in an hour, so I'll make these slides available to you to make sure that you can go back and look at them, click on the links and look at the research papers for yourself. In terms of hormone changes that occur with aging, it's really a paradox that after the age of 40, there's a 1% decline in testosterone every year in men. But at the same time, more of the testosterone that reaches the prostate gland is converted into the more dangerous type of testosterone known as dihydrotestosterone, or DHT. And as the DHT builds up, it causes the prostate cells to divide at a faster rate, leading to enlargement and also increasing the number of genetic mistakes. As cells divide quickly, they make more genetic mistakes that can lead to prostate cancer. So that age-related change in hormone is very important in terms of that buildup of DHT. Of course, as you get older, there's less growth hormone and melatonin levels also decline. It's important to note that melatonin not only helps to maintain stronger immunity, but prostate cells have melatonin receptors right on the surface, allowing melatonin to enter. And melatonin has a protective effect against enlargement and prostate cancer in many studies, as I will show you. So here's that decline in testosterone that occurs in men after the age of 40. And here's the very precipitous drop in melatonin that occurs with aging. And these two factors, the buildup of DHT in the prostate and the decline in melatonin, are hormonal changes that very much seem to influence the risk of enlargement and prostate cancer, as I will show you. So how do you build up this dihydrotestosterone? Well, remember that all the cells in the body, when they make steroid hormones, are really taking the LDL cholesterol particle out of the bloodstream. And I'll do a whole separate webinar just on lipoprotein physiology, all these LDL, HDL, VLDL, chylomicrons, because practitioners forget this all the time. But basically, cholesterol is being sent through the bloodstream from the liver in the form of LDL cholesterol. The LDL goes into the cells, including the cells of the testes, as an example, and the adrenal glands in men and women, of course, in the ovaries as well. But that cholesterol in this particular pathway that we're focused on today is going to go to pregnenolone, to dehydroepiandrosterone, to androstenedione, then to testosterone. And then when that testosterone arrives in the prostate gland, it's this enzyme, pay attention right here, it's this enzyme, the 5-alpha reductase enzyme, that converts testosterone into dihydrotestosterone, and that's the dangerous form of testosterone. So even though you're making less testosterone overall, the amount that you're converting into DHT is increasing after the age of 40. And this is the hormone in the prostate that causes cells to divide more rapidly, leading to enlargement and cancer risk. So these are a whole bunch of in male andropause, as men get older, instead of calling it menopause in men, we call it andropause. But there's lower blood testosterone, but there's an increased conversion to the DHT in the prostate gland. Notice also that there's more estrogen. When estrogen levels are higher, estrogen tends to slow down the breakdown of DHT. And so if you gain fat, a lot of men, as they get older, they lose lean mass, their metabolism slows down, so they eat the same number of calories, so they have more fat. So their body weight's the same, but they have more fat mass. And then the fat increases the conversion of androstenedione, which is secreted by the adrenal glands, but picked up and converted then into estrone in the fat cells. It gets released into the bloodstream, and estrone exerts influences on the prostate gland by slowing down dihydrotestosterone breakdown. So you're raising DHT even higher when your fat mass is elevated. So the way that I can prove to you that DHT increases as you get older, So you know that testosterone declines. Everyone agrees with that. But how do you know that DHT is increasing? Because even in the liver converts testosterone into DHT as well and sends it out into the circulation. And it's that DHT level that causes male pattern baldness. So what's interesting is that the 5-alpha reductase enzyme in the liver is not exactly the same 5-alpha reductase enzyme that's in the prostate gland. Because if that were the case, then the nutrients that I'm going to show you that can inhibit the buildup of DHT in the prostate gland would also work in the liver, and males would never go bald. But because these are isoenzymes, they're not quite the same. The nutrients I'm going to show you that inhibit the 5-alpha reductase enzyme in the prostate don't work nearly as well in the liver. So DHT does build up in men after the age of 40, and male pattern baldness, of course, occurs as men get older because they're increasing their synthesis of DHT. And the same thing's happening in the prostate gland. And don't let any doctor ever tell you anything other than that. We also know that DHT is highly responsible for these diseases, because in men who are castrated and they have that part of their testes removed where they don't make testosterone, they don't develop prostate cancer. Men who are born with an inborn error of metabolism where they don't make the enzyme, 5-alpha reductase enzyme, they never develop prostate cancer. In societies where young boys of a lower socioeconomic status are castrated when they're still boys, so they never actually become men, and they serve the aristocratic members of society, pretty archaic way of living. But in those eunuchs, no prostate cancer cases ever reported. So if you don't make DHT, you don't get prostate cancer. It's just that simple. And DHT not only increases the rate of cell division, but if prostate cancer cells form in the prostate, DHT increases the rate at which they're going to divide. It also causes free radical damage to prostate cells. This is why I don't like the idea of hormone replacement therapy for men. Giving men, as they get older, more testosterone to give them more virility and more lean mass, increasing the amount of DHT. And if they already have some prostate cancer cells lying there dormant, it's like putting fertilizer on them. It's going to cause it to balloon and become a clinically significant cancer. So I don't like hormone replacement therapy for men. Also, we know that all the cells of the body can take some cholesterol and convert that cholesterol into testosterone, including prostate cells. So men that have higher blood cholesterol, because they eat a lot of higher risk for prostate cancer. We've seen that. And when men use statin drugs to lower their cholesterol, then there's less cholesterol available, and that seems to somehow mitigate some of the risk of a high-fat diet with respect to prostate cancer, but doesn't totally eliminate it, as you're going to see. So here's what it looks like if we look at a prostate cell. So here is this big rectangle. If you can see my mouse, is one prostate glandular cell. And so there are receptors so that the testosterone made in the testes can enter into the prostate cell, because these are fat soluble. They can go through the membrane attached to a receptor. And then in the prostate cell, it gets converted into DHT via the 5-alpha reductase enzyme. If you can block that enzyme, that's a winner. And I'm going to show you how to do that. But notice in the male prostate gland, that from the adrenal glands can also take cholesterol and convert it into androstenedione and dehydroepiandrosterone, or DHEA, release that into the bloodstream, and they can also enter the prostate cell and be converted into testosterone and then into DHT. I'm telling you this for a reason. There are drugs like finasteride, also known as Proscar. Those drugs are developed to help reverse benign prostatic hyperplasia. What do? They block the 5-alpha reductase enzyme to decrease DHT synthesis. But they don't block testosterone from entering. They don't block androstenedione from entering. They don't block dehydroepiandrosterone from entering the prostate cell. But there are natural agents that do all of this and more. Then not only do they inhibit the 5-alpha reductase enzyme, but they act as an androgen blockade so that you don't get overstimulation of the prostate cell. Less of these enzymes or these hormones can even enter the prostate cell in the first place, including estrogen or estrone hormone. So in that review paper that I showed you earlier that I'd like you to read, if you click on it, you'll see the actual clinical evidence where certain natural agents have been used to reverse benign prostatic hyperplasia. So if it can reverse it, I can tell you right now that you can prevent it. So in all men over 40 should be paying attention to using these nutrients every day. I'll show you how to do it. So saw palmetto, this palm tree that grows along the shores of Florida and into the parts of the Caribbean along the Atlantic coast. The berries contain these fatty acids and sterols. And at a specific dose, at its standardized grade, 160 milligrams twice a day, at a standardized grade of 85 to 90% fatty acids and sterols, or doubling the dose with the standardized grades of 45% fatty acids and sterols, you get the same medicinal ingredients. It's been shown to reverse benign prostatic hyperplasia just as well as Proscar or finasteride with fewer side effects. Not only does it block the 5-alpha reductase enzyme, but it's also an androgen blockade. It blocks it blocks the entrance of testosterone and androstenedione and DHA from so much of it getting into the cell. It helps to downregulate how much hormone even gets into the cell to be a precursor to DHT. It even blocks estrogen from getting into the cell, which is important. That allows the DHT to get broken down and also has anti-inflammatory effects. Now, just eating saw palmetto berries isn't going to do anything because the berries themselves are only 1% fatty acids and sterols. So you need to get a standardized grade of saw palmetto, which we've used in our Prostate 40 Plus product. But you have to add other things because, you know, herbal agents are great, but they're not powerful enough often by themselves. You need to combine to get synergistic effects. So the Pygeum africanum, which is the inner bark of the Pygeum africanum tree, contains these triterpene compounds, also have been shown to reverse benign prostatic hyperplasia in human clinical trials with men that have mild to moderate disease. There's still an argument as to how Pygeum works, but that's the standardized grade and the dosage that has been shown to be effective. Now, in the saw palmetto berry, one of the sterolic compounds is beta-cytosterol. And in experimental studies, it shows all kinds of amazing things. It blocks the 5-alpha reductase enzyme. It blocks estrone synthesis in the fat cells. So in your fat cells, you don't convert as much androstenedione into estrone in the first place. That's a great thing. It's been shown to cause programmed cell death of certain human prostate cancer cell lines. I'll show you how it does that in a minute. So in men that have mild to moderate enlarged prostate glands, beta-cytosterol alone as a single agent at 65 milligrams twice per day or 20 milligrams 3 times a day has shown a very high success rate. But again, it's doing more than just what the drugs do because it has other secondary benefits, of which, and the experimental studies show this quite well, that in prostate cancer, certain prostate cancer cells, it upregulates caspase 9 and caspase 8, which induces apoptosis. It rips apart the mitochondria of the cancer cell, so it can't make energy, and now the cell must undergo programmed cell death or apoptosis. So it selectively gets cancer cells to commit suicide, leaves the normal healthy cells alone. And you cannot make drugs that do that, not yet. That's an unbelievable thing. And same with soy isoflavones. So I don't know why men would be afraid to have soy products, but this should be something that men are focused on, because men who average 25 to 75 milligrams a day of soy isoflavones from any source have a much lower incidence of prostate cancer worldwide and even enlargement. The isoflavones in soy, which specifically are adenosine and diadzine, not only do they inhibit the 5-alpha reductase enzyme, but they've been shown to also induce apoptosis of certain human prostate cancer cell lines. They inhibit certain proliferative enzymes to slow down the rate of cell division. They increase sex hormone binding globulin from the liver. So the liver, when it secretes sex hormone binding globulin, it binds to testosterone and androstenedione and dehydroepiandrosterone in the circulation. So less of those hormones are available to even enter the prostate cell in the first place. It also is an aromatase inhibitor, so it blocks the synthesis of estrone hormone in fat cells. Also a tremendous prostate antioxidant. It also inhibits angiogenesis. I'll show you this in a moment. Also an androgen and estrogen blockade. Soy isoflavones do it all. They do everything that you want in terms of prostate protection. This is angiogenesis. So I may have shown you this before. If a solid tumor is forming in the body, once it gets to a certain size, as the cells keep dividing, they're not going to get enough. There's only so much blood and nutrients to feed all the cells. So once you get a tumor that's 1 to 2 millimeters in size, the tumor cells secrete vascular endothelial-derived growth factor, or VEGF. VEGF causes new tributaries to form into the tumor to give it more blood, and so the mass can keep growing, and then you can have metastasis. Well, you can inhibit VEGF secretion with soy isoflavones. It has anti-angiogenesis properties. And they're trying to make drugs that can do this, and they haven't had a lot of success yet. Stinging nettle is a weed that also, what it does is inhibits the ability of DHT, dihydrotestosterone, to bind to the nucleus of the cell, where it's going to exert its effects on causing the cell to divide. So stinging nettle is a nice additional natural ingredient to combine with other prostate protective agents. Studies show about 20 to 60 milligrams a day in most combination products is helpful. And then where there's just strictly prostate inflammation, not really hyperplasia, but just inflammation, that ryegrass pollen extract has been shown to be a nice additional agent as a sort of a separate entity. It contains hydroxamic acid, which also has some, we think, anti-cancer properties as well. So when I turned 40 years old, roughly just shortly after that, and I was reading this research very carefully, I put together the absolute Cadillac prostate product that I think every man over the age of 40 should take, because I didn't just put the ingredients in that are helpful. I put in the exact dosages of each nutrient that has been shown in human clinical studies to reverse benign prostatic hyperplasia. And I will tell you, if you can reverse it, you can prevent it. And remember that many of those agents, unlike the drugs, have secondary properties that are shown to be helpful in, we think, being able to prevent cancer biological changes. And I will show you that some of these nutrients have been used in patients that have prostate cancer, and they've been used as agents in the complementary management of, and you'll see the incredible results people get using these as a complementary measure as part of cancer treatment, not standalone, but as a complementary measure. So let's talk about prostate cancer. So we have a very high incidence of benign prostatic hyperplasia in our part of the world. It's like the canary in the mine shaft. The more BPH incidence you have, usually is the higher rate of prostate cancer you have, because both of these conditions are driven by the same mechanisms. The cells are dividing too quickly. So you have an 80% higher incidence of prostate cancer in North America than you do in many parts of Asia, where dietary lifestyle is very different. And then when you have immigration, you have migration of people from Asian countries and Eastern Europe and Africa. When they come to this part of the world and they assume our lifestyle behaviors, their prostate cancer rates go through the roof within one generation. But what we know is that in all countries around the world, by the time men are 45 to 50 years old, 13 to 32% of all men have some prostate cancer cells that have already formed, even in low-risk countries. The difference is that diet and lifestyle can put fertilizer on those cells and encourage them to grow, or diet and lifestyle can help suppress those cells from ever manifesting into a clinically significant cancer. So we see this low-risk country show up to an 80% lower progression, even though there's cancer cells there in Japan and China and Eastern Europe and certain countries in Africa, where they have a low incidence of prostate cancer death and BPH problems. They still have some cancer cells, but they don't manifest into clinical disease. Whereas in this part of the world, it's the second or third leading cause of cancer death in men. So if you look at the world map, you see that Canada and the United States are just an absolute disaster. We have really, really high incidence of prostate cancer here. But that's not how it is across the world. And diet and lifestyle seem to be the major modulating factors. Here in Canada, after age 40, the prostate cancer incidence just takes off. And you want to prevent that. If you're a male listening to this, you want to prevent this in yourself. You want to prevent this in your male relatives, and you want to prevent this in your patients as best you can. I'm going to show you what the evidence suggests is possible. And once again, the leading experts in the world have told us that 75% of these cases don't have to occur in the very first place. Some prostate cancer is highly genetic, but the majority of it is not. So prostate cancer is classified as an adenocarcinoma. That means it starts in the glandular cells. When those cells start to mutate, they start to first go into a precancerous state known as prostatic intraepithelial neoplasia, or PIN. And we think that what happens is then those cells keep dividing. They eventually become more cancerous and more malignant in their appearance and their behavior. And then if you catch that prostate cancer while it's still localized in the prostate gland, then, treatment is possible. You save people's lives. But as soon as, if you allow it to get beyond the prostate capsule and it invades the seminal vesicles or the rectum or gets to the lymphatic system and travels and sets up a new colony in bone, especially in the spine, that's where a lot of this travels to. Any male over the age of 50 with, low back pain or bone pain of any kind that doesn't follow an orthopedic pattern, you need to be thinking, is this prostate cancer that is metastasized? Of course, it can also spread to the rectum and the bladder, like direct invasion. So there are genetic risk factors, and men that develop prostate cancer very early in life, under the age of 45, often that's a genetic situation. But for most men, they develop it after that, and those cases seem to be preventable. There are some mild sensitivities in terms of genetic inheritance. If your mother had breast cancer and she was diagnosed with the BRCA1 or BRCA2 gene, then you as a male can inherit that BRCA1 or BRCA2 gene defect, which is that gene codes for enzymes that repair genetic damage. So if you can't repair genetic damage, there's a greater risk that you're going to get cancer. And prostate cancer is one of the cancers that's associated with the BRCA1 and BRCA2 gene mutation that's inherited. So those men have a higher risk for prostate cancer, but not all men that have that particular gene develop prostate cancer. The trick is, don't let your cells divide too quickly in the first place. Having a brother or a father doubles your risk. Now, that's my own personal family history. I have double the risk for prostate cancer. But at age almost 67 now, my PSA blood level is still 0.25, which is extremely low. If you get to be 60 years old and your prostate-specific antigen blood level is below 1 nanogram per milliliter, your lifetime chance of having prostate cancer is virtually zero. So even though I personally am in a very high-risk category, I followed all the rules I'm showing you today, and it's very much helped to keep my PSA blood level in a safe range. African Americans tend to have more prostate cancer. It might be because their vitamin D levels are very low, and or they have vitamin D receptor polymorphism. It's harder for vitamin D to bind to receptors in their cells to exert anti-cancer effects. So some of that has been shown in the research. We'll get to that. In terms of the prostate-specific antigen, or the PSA, what is it? Well, it's a serine protease enzyme that's secreted by prostate cells, and it's there to sort of liquefy gelatinous semen so that it's easier for the spermatozoa to navigate through the cervix and impregnate or fertilize an egg up there in the fallopian tube. So PSA levels start to rise if you have prostate cancer, but even with prostate enlargement, the PSA level can be elevated. If there's an infection, you have like a bacterial infection of the prostate gland, the PSA level can be higher. Within 24 hours after ejaculating, the PSA is usually slightly higher. When males need to be catheterized because they have a urinary tract infection, the catheter can also irritate the prostate, and you get a higher PSA level. So it's not always prostate cancer if the PSA is climbing higher. The only way to know for sure if you have prostate cancer is by doing prostate biopsy. And there's some tests now where they look at the PSA versus the bound or the unbound, and they're still trying to figure out how important that is. Of course, by doing digital rectal examination, you can sometimes feel prostate cancer. By the time you can feel prostate cancer, it's already very advanced. The person's not going to be alive too much longer. So relying on digital rectal exam for prostate cancer diagnosis is not, highly efficacious. The PSA blood test is the life-saving assessment tool. So when we look at the PSA blood test, you can look at the different recommendations made by different prostate cancer authorities. But generally speaking, the best advice I can give you is to make sure you never have a PSA level that's above 1 nanogram per milliliter. If you just do that, you have nothing to worry about. What's scary is when the PSA blood level is above 4. That's when they're probably going to want to do a biopsy. And with biopsy comes risk of infection or irritation or bleeding, and they can hit certain nerves. But you're basically in a situation where you have to go through that procedure to see if you have prostate cancer. If it's localized, they can do something about it to save your life. You don't want to find out you have a PSA of 125. By then, you know it's already spread through your body, and the treatment measures are highly ineffective. So, but also if your PSA is above 2.5, I can tell you there's probably already prostate cancer cells there. It's just a matter of time. So you want a PSA under 1, and if in any given year, if your PSA rapidly increases, that also is sort of an indicator that you may need to have a biopsy done. So keep your PSA blood level below 1. Do the things I'm going to show you. You won't regret it. Again, if you have the biopsy done, it can cause pain and bleeding and infection. You want to try to be in a situation where you never have to even undergo the biopsy. Because if they find prostate cancer there, they're going to say, okay, one of our options here is to remove your prostate gland, which then leaves you incontinent, maybe for the rest of your life, or maybe just for a period of time, and impotent, maybe just for a short period of time, or very likely you're impotent for the rest of your life. These are quality of life issues. So you don't want to be in this situation if you can avoid it. It really is worth the effort through nutritional medicine and lifestyle medicine to make sure as best you can you don't find yourself in this situation. So because most prostate cancers, even if they're there, they grow very slowly, the person usually dies of something else first. So it's a shared decision-making process as to what the treatment's going to be between the patient and the urologist or oncologist. And then there's the Gleason score. So what is the Gleason score? When they do a biopsy, they take 2 of the most suspicious areas, basically, and they take samples, and then the pathologist gives them a Gleason score between 1 and 5 of the 2 samples. And so the more malignant the cells look, the higher is the Gleason score. So if they took the 2 samples and sample 1 was a 5 and sample 2 was a 5, you've got a Gleason score of 10. That's a very aggressive prostate cancer. You don't want to wait around. You need to get something done. But if the Gleason score is 2 or 3 or 4, those cancer cells are not highly malignant looking, so it might be a prostate cancer that's more slow growing. You might be able to control it through diet and lifestyle, as I'm going to show you. So here's what it looks like on the histological slides. These would be a Gleason score of 1, Gleason score of 2, Gleason score of 3, 4, and 5. So the more malignant and irregular that the tissues look, the higher the Gleason score. So you add the 2 samples together, you get a score out of 10. On a histological slide here, you see normal glandular cells in the prostate. Here you see very irregular cells that are meshing together, and these would be highly irregular and very neoplastic looking cancer cells on the histological slide. And the ultrasound is done transrectally. So, I mean, this, who wants to go through this? I personally don't ever want to have to be in a situation where I have to have a transrectal ultrasound, somebody sticking needles into my prostate gland to do biopsies. So ideally, you want to try to prevent this as best you can. And if it's not possible, if it's too late, then this is life-saving stuff to go through. So that's sort of what that probe looks like as they go in through the rectum to get an image of the prostate. Now, even in men, sometimes they will, if the prostate cancer develops, they give the prostate gland this sort of assessment. Is it androgen dependent or androgen independent? In androgen dependent prostate cancer cells, they often will give drugs to the patient if it's already spread through their body. If it's beyond the prostate capsule, they give them drugs to help block the effects of testosterone on those cancer cells, wherever they might be. But usually within a year or two, the prostate cancer cells mutate. They're not even dependent anymore on outside testosterone. They can just self-stimulate themselves internally, and usually the cancer then starts to spread again, and the person basically doesn't live much longer. So there's no really good, once prostate cancer is spread beyond the prostate capsule, your chance of survival is not very good. So is there a relationship between nutrition and prostate cancer? Well, I showed you that 75% of it's very likely preventable, according to Walter Willett, who's a leading researcher at Harvard. So what are the things that where does the evidence point? The evidence points to alcohol as being a major driving force in the development of prostate cancer. All the studies show this, dating right back to the Harvard alumni study and many other ones since then. The 2016 meta-analysis review of 27 available studies showed this in spades, that the more alcohol a man drinks, the greater is the risk they're going to develop prostate cancer. It's dose dependent. The best thing you can do is not drink alcohol at all. Heterocyclic amines that are formed when you pan fry meats or when you char foods, strongly linked to prostate cancer. These are mutagenic. A lot of studies show an increased risk of prostate cancer in men consuming these foods. Also processed meats as well, more advanced prostate cancer, men eating a lot of processed meats, luncheon meats, bacon, sausage, pastrami, corned beef, all that stuff off the list. And saturated fat, the first study to show this was the Health Professionals follow-up study by Edward Giovannucci, but many studies, including this recent one in 2016, done by the American Association for Cancer Research at their annual meeting in New Orleans, the North Carolina, Louisiana Prostate Cancer Report, showing that men that are eating a lot of saturated fat from beef and cheese and all the other things that have a lot of saturated fat, their prostate cancer rates are much higher, especially with advanced prostates or more aggressive prostate cancer. And one of the mechanisms seems to be that high intake of saturated fat raises cholesterol synthesis in the body. From cholesterol, you make more testosterone, you make more dihydrotestosterone in the prostate gland, and we're off to the races. Men that are on statin drugs for high cholesterol seems to mitigate some of that risk, but doesn't completely reverse it. Whereas men that are having more healthy fats from omega-3 fats and monounsaturated fats, it seems to help guard against prostate cancer. A lot of studies show saturated fat increases prostate cancer risk, including studies on the Adventist Health study, where you see vegan men had a 35% lower risk of prostate cancer than men who are omnivores. There's just all kinds of evidence for this. So it doesn't mean you have to be a strict vegan or vegetarian, but foods that are high in saturated fat, you have to keep them out of your diet. And deep fried foods, trans fats, all those bad fats, they increase risk of cancer everywhere in the body, but particularly hormone sensitive cancers. And then soy isoflavones, the more you're consuming of these, the studies show that men that consume more soy isoflavones, they have a decreased risk of cancer. That evidence is consistent worldwide for all the reasons that you see on this slide. And omega-3 fats, there's been some controversy in recent years. Do omega-3 fats, do they increase risk or they decrease risk? But the preponderance of evidence suggests very strongly that it decreases risk. So this recent report from the Mayo Clinic in 2014 state this, that the preponderance of evidence suggests that higher intake of omega-3 fats decreases risk of prostate cancer, advanced prostate cancer, improves survival in prostate cancer patients who have been treated, and is associated with increased longevity overall by 2.2 years. So omega-3 fats, we think, are helpful, and it makes sense that they would be, because you're going to make prostaglandin series 3, which slows down the rate of cell division and reduces inflammation. It just stands to reason. And the indole-3 carbinol from cruciferous vegetables, I mean, this is a gift of nature, like broccoli, Brussels sprouts, cabbage, cauliflower, bok choy, turnips, contain that indole-3 carbinol. All kinds of studies in humans and also in experimental studies show all the different mechanisms through which the indole-3 carbinol can inhibit prostate cancer development and cancer of other tissues as well, colon, breast, cervix. And a couple of the ways are by stimulating these tumor suppressor genes, which I'll show you, and downregulating cyclin D. So here you see inside the nucleus of the cell, there are these tumor suppressor genes, the P27 and P21. If a cancer cell is emerging, it'll stimulate the cell to undergo programmed cell death, so that the cell will take itself out of circulation and not become a risk. Also, if you inhibit cyclin D, And cyclin D is part of the signaling agents in the cell cycle. It'll stop the cell from dividing while the tumor suppressor genes are encouraging the cell to undergo apoptosis. All kinds of just incredible studies showing the role of indole-3 carbinol, also improving detoxification to get cancer-causing agents out of the circulation on a regular basis. So I eat cruciferous vegetables, but I also take this product that I made a number of years ago called Adëeva Immunodetox Prime, because it gives me a nice, good dose of indole-3 carbinol every single day, along with milk thistle and astragalus and reishi mushroom extract for both immune and detoxification purposes. But the indole-3 carbinol inhibits the cell cycle, induces apoptosis in certain human prostate cancer cell lines. It's just an incredible anti-cancer gift. Every day, those vegetables should be in your diet. It also inhibits the AKT and nuclear factor kappa beta pathway. Let me show you that pathway quickly. In cancer cells, prostate cancer cells included, what happens often is you get increased stimulation of receptor tyrosine kinase down through phosphatidylinositol-3 kinase, down to nuclear factor kappa beta. That then goes to the nucleus and tells the cells to divide at a faster rate. So this inhibiting this particular system down through nuclear factor kappa beta, specifically in cancer cells, has been shown to be an incredible anti-cancer function of the indole-3 carbinol as well. So this is what these, in 2004 in this review paper, they said, there's no effective treatment strategy for hormone-dependent prostate cancer. Most importantly, hormone-independent and metastatic prostate cancer. Our strategies to sensitize prostate cancer cells to a chemotherapeutic agent by the indole-3 carbinol and its byproduct, which is known as DIM, is a novel breakthrough that could be useful for devising novel therapies for prostate cancer. Because of all these mechanisms through which the indole-3 carbinol has been shown to not only block prostate cancer cell development, but also encourage prostate cancer cells to commit suicide or help to prevent desensitization to prostate cancer drugs, that the indole-3 carbinol likely can be used even with certain cancer drugs to make sure the drugs are working more effectively. So that's where the research is going here. Then there are these prostate antioxidants that are of great significance, like lycopene from tomatoes. And of course, soy isoflavones also have antioxidant properties. There's a whole thing on vitamin E succinate that we'll cover in another webinar. Of course, higher blood vitamin D levels, as you likely know, is related to decreased prostate cancer risk. The thing to know is that the prostate cells have vitamin D receptors right on them. And so when vitamin D enters the prostate cell, it's going to ultimately have the effect on slowing down the rate of cell division. And it's also going to help cells differentiate into more mature or highly differentiated cells. Even in prostate cancer cells, they still have vitamin D receptors. So when you stimulate those receptors, it helps to slow down the rate at which the cells divide in some cases and forces the cell to be a more normal looking cell and less malignant properties. And so that's what the experimental studies have shown. If you live in this part of the world above the 42nd degree latitude, man, you're not going to get enough vitamin D from sunlight. So you're going to have to take supplements to get vitamin D to get the year-round levels that are required to protect your prostate gland. I'm going to show you a study later of men with prostate cancer where they gave them vitamin D supplementation, and it helped to slow down the PSA rise. But many integrative cancer doctors that I know personally with prostate cancer, they give prostate cancer patients 10,000 to 50,000 IUs a day to stimulate the cancer cells to slow down the rate of cell division to make the other integrative therapies work more effectively. But unless you can do blood testing for vitamin D blood levels on a regular basis, you can't just be giving people arbitrarily these high levels. You have to look at how it's affecting their liver. If the blood level goes above 250 nanomoles per liter, now you're getting into vitamin D toxicity. So the everyday practitioner can't just do this, but integrative medical doctors who can do blood work and some naturopaths who can do this kind of blood work can use these interventions. Of course, zinc affects the prostate gland. The prostate gland concentrates a lot of zinc, and it's been shown to also sort of inhibit benign prostatic hyperplasia. We think it inhibits dihydrotestosterone synthesis to some degree. Most men don't get enough zinc, but if you just get some from a multivitamin, you're already in pretty good shape. Being more cardiovascularly fit has been shown to be helpful. If your resting heart rate is lower, there's less sympathetic tone. A high sympathetic tone we think it stimulates the prostate gland in some ways that may increase prostate cancer risk. But even in men who are highly fit, they still get prostate cancer. So just thinking that fitness alone is going to just be your savior from developing cancer in your lifetime is a mistake. You can't just eat whatever you want and stay fit and think you've got cancer protection, because you don't. There are some amazing studies where they have used specific nutrients in men that already have prostate cancer. The nutrients that I've shown you already, I'm not the only one looking at this research. So cancer researchers go, lycopene, this is unbelievable. All these soy isoflavones are unbelievable. This vitamin D is unbelievable. Why don't we try this in patients that already have cancer and see what happens? Well, here's the studies that we have today. Here's a study, soy isoflavones, 100 milligrams a day given to men with existing prostate cancer. And it showed that it stabilized the PSA, started to stabilize, and it slowed the rate at which the PSA is rising. The only way you can do that is by slowing down the tumor growth, which is amazing in men that already have prostate cancer. And then in vitamin D, just even giving them a low dose here, I think they only gave them 2,000 IUs a day. But in these 9 individuals, the PSA level decreased or remained unchanged, and that effect was sustained for a 21-month period. So it decreased the rate of the PSA rise in the group that got the vitamin D. And when you slow the PSA doubling time, if it goes from 14 months to 25 months, that's a very good indicator. So in fact, 14 of the 15 patients showed a prolongation of the PSA doubling time. What we know is that with respect to risk of distal metastasis in prostate cancer, at 5 years, if you can slow the PSA doubling time, so if it goes beyond 10 months, then the risk of distal spread is only 10 to 20%. Whereas if the PSA doubling time is less than 10 months, then the risk of distal metastasis is 65 to 75%. So vitamin D seems to be able to slow the rise in the PSA, like soy isoflavones in the previous study. So researchers are saying this might be a very good adjunctive measure to give to prostate cancer patients, as many integrative cancer doctors now do. And there's 6 studies using lycopene, that sort of antioxidant carotene found in tomatoes. So you have these 26 patients here who were scheduled for a radical prostatectomy. They were given tomato sauce paste high in lycopene to consume 3 weeks before the surgery. It showed that it exhibited they exhibited decreased serum PSA levels and increased programmed cell death in their tumor and the enlarged prostate tissue. So these are men that have prostate cancer. Giving them lycopene, it's inducing programmed cell death, apoptosis, and their PSA level is going down. I mean, that's shocking. There are no drugs that can do that. Here's another study in 2004. Men that had hormone refractory prostate cancer. That means they did everything they could. They gave them hormones to block the metastasis of the cancer, but it was doing its own thing anyway. They gave them 10 milligrams a day of lycopene. 50% had PSA levels that remained stable, so the PSA stopped rising. 15% had progression. 30% showed a partial response, and one of the patients actually had a complete response, and the PSA started to drop down. So from one person to the next, you can have different kinds of prostate cancer cells. Sometimes they're really sensitive to these natural interventions. Sometimes they're less sensitive. There's no way to predict it. This group of prostate cancer patients given 30 milligrams twice a day for 3 weeks prior to a radical prostatectomy. They showed that upon prostatectomy, the ones that got the lycopene, the tumors were smaller and the PSA levels were lower than the group that got the placebo. The 4th study, 10 milligrams a day were given to this group that had PSA velocity in patients that had localized prostate cancer. It significantly decreased the PSA velocity. So soy isoflavones, vitamin D, lycopene, all having this effect on slowing the PSA rise in men that already have prostate cancer. And the same thing here in men that have this high-grade prostate intraepithelial neoplasia, or this PIN, which is the precancerous condition, just giving them 4 milligrams of lycopene twice a day. It's not very much, right? During the follow-up, the adenocarcinomas occurred more often in the patients who did not receive the supplement. So after a period of time, the group that didn't get the lycopene showed a much higher likelihood of the precancerous condition moving on to be a true malignancy. So lycopene may be effective in preventing precancerous lesions from progressing to clinically significant prostate cancer. They don't have drugs that can do this yet. Here's the sixth study where they gave men either lycopene or soy isoflavones. Some got none of those things. Some got the combination. Some just got soy. Some just got the isoflavones. The long and the short of it is that the soy isoflavones and the lycopene help to stabilize the PSA levels. Then there's these incredible studies recently, green tea. So in green tea, you have these polyphenolic compounds called catechins, like epigallocatechin gallate. And so experimental studies had shown that those polyphenols in green tea had an incredible anti-cancer effect on prostate cancer. So they took men that had this precancerous condition known as PIN, or high-grade prostate intraepithelial neoplasia, and they gave a certain group of them green tea catechins, where they got 600 milligrams a day of green tea catechins. After 1 year, there's only one tumor diagnosed in the 30 men who got the green tea catechins, whereas 9 cancers were among the 30 men who were in the placebo group. So 3% of the men that got the green tea went on to have prostate cancer within a year, whereas 30% of the men who got the placebo went on to have prostate cancer within a year. So they followed that up. They also, the green tea category also had PSA levels that were consistently lower, and also helped to reverse their prostate enlargement and reduce their symptoms of lower urinary tract symptoms, so they could urinate more easily. Then in 2009, they followed up. They took men who were scheduled for, they had positive prostate biopsies. They ingested 800 milligrams of green tea catechins until the time of the radical prostatectomy. So that for a little over a month, they took green tea catechins, 800 milligrams a day. And as the men that got the green tea catechins showed their PSA levels were lower, they also had lower blood levels of hepatocyte growth factor. So hang on to that. I'll come back. I'm going to show you what that is. They also had decreased vascular endothelial-derived growth factor. That's the molecule that causes angiogenesis. So you're inhibiting angiogenesis. They also had lower insulin-like growth factor 1, which is also a driving that causes cells to divide faster. So you're lowering all these metastatic biomarkers, and the liver function tests were normal. Some people say, you take green tea catechins, it's going to damage your liver. It didn't damage anybody's liver, even in these cancer patients. So it had all these great effects on men who had prostate cancer, who were scheduled for a radical prostatectomy. They only took the supplement for like a month. So here is what hepatocyte growth factor is. So in tumor cells, prostate tumor cells and breast tumor cells, when they become really malignant, they overexpress on their cell surface this c-MET receptor. And then fibroblasts and other stromal tissue cells secrete hepatocyte growth factor, which stimulates that receptor. And when it does, it increases metastasis and cell survival and proliferation, and you get the cell dividing at a faster rate. It's a huge indicator that the tumor is going to metastasize. So the group that got the epigallocatechin gallate, or the green tea catechins, their blood levels of hepatocyte growth factor were much less. So they were not stimulating these receptors on the cell surface that would tend to encourage the cell to become very metastatic. So these are the references for these green tea catechin studies that I just cited for you. They're phenomenal research papers to read. And then there's pomegranate juice. Pomegranate juice contains ellagic acid, which has been shown to have incredible anti-cancer properties. Been a couple of studies showing that pomegranate juice has been helped to contain prostate cancer, but not every study that's been done to date has shown these positive effects. But I think in terms of helping to prevent prostate cancer, having 4 to 8 ounces of pomegranate juice each day makes a lot of sense, something that I try to do myself. And then melatonin, as I said, the prostate gland contains melatonin receptors. Low melatonin levels are strongly associated with increased risk of breast and prostate cancer, because both breast and prostate cells have melatonin receptors on them. And melatonin also stimulates immune cells to be more efficacious in their ability to hunt down cancer cells and kill them. So Dr. Lissoni was one of the first doctors in the world to use high-dose melatonin as an adjunct in the management of breast and prostate cancer. There's that drop in melatonin. Melatonin stimulates those CD4 T cells to become more highly efficacious and giving signals to the other immune cells to be very much better at killing viruses, bacteria, but also cancer cells as well. There are melatonin receptors, so melatonin enters the prostate cells on many levels and gets right to the nucleus of the cell in some cases, slowing down the rate of cell division, encouraging the cell to differentiate, just like vitamin D. Melatonin and vitamin D share a lot of common features. So studies as recently as 2015 in the International Journal of Cancer Clinical Research showing the anti-cancer properties of melatonin. Just it's multimodal in all the things that it does. So that drop in melatonin as you age is clinically significant in terms of risk for all kinds of cancers, including prostate and breast. And then this great study in 2005 by Dr. Dean Ornish. She's one of my heroes. He's a medical doctor at Stanford University. He wrote the book called Reversing Heart Disease, showing that he could take people with pretty advanced atherosclerosis. And in some of those individuals, just using diet and lifestyle alone could reverse the blockage on their blood vessels as shown by pre and post angiogram studies. And so he has this very vegetarian type diet, with fruit and vegetables, legumes, lots of soy products, that he gives individuals with heart disease. But he says, the studies show that the same diet might be helpful for cancer patients. So he took male prostate cancer patients who were diagnosed with localized prostate cancer that had a low to moderate Gleason score. You now know what the Gleason score is. He put them on his anti-heart disease diet, and he gave them some antioxidants, vitamin C, vitamin E, and selenium, because research has shown that these nutrients may be helpful as well. So he studied 93 men who had chosen not to undergo conventional invasive treatment. So these men said, I don't want to have this medical treatment. I'm going to be left impotent and incontinent. I'll just live with it because I have a low Gleason score, a low to moderate, and we'll just do watchful waiting. If the PSA really takes off, then I'll have treatment. But right now, let's just do watchful waiting. So half of these men chose to be in Ornish's program. The other half said, I'm not changing my diet. I want to eat steak and French fries and drink beer. I want to do whatever I want. Leave me alone. So the group, after 12 months, the group that went on to his diet and supplementation program, the PSA treated group of men had a decrease in average of 4% of their PSA. So they had localized prostate. Now their PSA is going down. Diet and supplements going down in men that have established, diagnosed, localized prostate cancer on biopsy. Whereas the group that just kept eating the typical North American diet, their PSA was 6% higher a year later. And then this ground flaxseed shows all kinds of incredible anti-proliferative effects on the prostate. You want to slow down the rate at which prostate cells divide, 2 tablespoons of ground flaxseed every day. What's in flaxseed are these lignans that you can't get anywhere else. There's 800 times more of these lignans in ground flaxseed than there is in anything else. So people, I want to have hemp seeds and I want to have chia seeds and I want to, forget that. Ground flax seeds has 800 times more of these lignans. These lignans get metabolized by the gut bacteria into enterolactone and enterodiol. They enter the bloodstream and they have incredible anti-proliferative effects, not only on prostate cells, but on breast cells, endometrial cells, and even in other cells that are sort of hormone sensitive, breast cells as well. So in this one study of 161 men who were scheduled for a radical prostatectomy, they gave some of the men ground flaxseed, they gave some men a low-fat diet, some men got ground flaxseed, the low-fat diet, some men got nothing. What they showed is that the results showed that men given the ground flaxseed had a slower replication rate of their prostate cancer cells than did the men not taking flaxseed supplementation, or men on the low-fat diet. Low-fat diet didn't show a great effect. Ground flaxseed was the thing that was able to inhibit proliferation of existing prostate cancer cells. The researchers conclude findings suggest that flaxseed is safe and associated with biological alterations that may be protective for prostate cancer. 2 tablespoons a day. And then there's just one unbelievable study here in the Journal of Urology in 2001. This is a real one-off case. You wouldn't expect to see this in your lifetime. Even a urologist probably would see this like once in a lifetime, maybe, where a 62-year-old man who has androgen-independent metastatic prostate cancer, it doesn't become more lethal than that. The guy has a PSA level of 365. It's like in another orbit. This guy's going to die, no question about it. He does some research on his own. The patient decides to take 10 milligrams of lycopene and 300 milligrams of saw palmetto 3 times a day. And his PSA goes after just a month from 365 to 140. After 2 months, his PSA is down to 8.1. So the tumor cells are committing suicide. That's the only explanation for this. The tumor is shrinking. So he just happens to have a type of prostate cancer cell that is highly sensitive to these natural agents. But just don't count on being that lucky person, because these cases are few and far between. But, animal studies show all these incredible anti-cancer properties of saw palmetto and beta-cytosterol, lycopene. I mean, the experimental studies are incredibly eye-opening. So there's some other nutrients you may want to explore on your own, like modified citrus pectin. I'll do a webinar on vitamin E succinate one day. And in China, they use Chinese skullcap. That particular herb contains the bacilline flavonoid that inhibits the 12-lipoxygenase. Prostate cancer cells and other cancer cells often use that pathway for replication. So it's very hard to find Chinese skullcap in North America. This is my advice to all men. If you want to help decrease the risk of benign prostatic hyperplasia and prostate cancer, then you should do what I'm about to summarize on this slide. Eat a low saturated fat diet with no trans fats, or keep them low, no deep fried foods, and no foods high in cholesterol. Just get that stuff out of your diet. Stay at your ideal body weight so you don't have fat cells that are making too much estrone hormone. I would not drink. I stopped drinking alcohol 37 years ago. I still have had a really good time in life without it. So, just think about that. Tomato products, get the lycopene from tomatoes as best you can, at least 4 times a week. Have soy products at least 3 times a week, maybe more, from all those different sources. Get those isoflavones into your body. Cruciferous vegetables at least 5 times a week. Remain fit, but don't overtrain and weaken your immune system. Stay away from pan-fried meats and other sources of heterocyclic amines, like charred meats on a barbecue, blackened swordfish, charred burgers, all that stuff. 2 tablespoons of ground flaxseed a day. I put it into my protein shake and it's done. 4 to 8 ounces of pomegranate juice a day. Even 4 ounces is great. I mix into the pomegranate juice the 14 mushroom blend that I've told you about in other webinars. So I just get, a double shot. I get my pomegranate juice and my 14 mushroom blend all at once. Make sure your vitamin D blood level is above 85 nanomoles per liter. Have fish a couple of times a week if you're not a vegetarian or a vegan. And try to have 3 to 5 cups of green tea every day. In terms of supplements, this is what I suggest you do, that you take the Adëeva Nature's Essential Oils. Get your fish and your flaxseed oil there to make the omega-3 fats, to make prostaglandin series 3, to slow down the rate of cell division, and borage seed oil to make prostaglandin series 1 anti-inflammatory. The Adëeva All-in-One Multivitamin has those antioxidants that Dean Ornish used, the vitamin C, the vitamin E, the selenium, along with the first 1,000 IUs of vitamin D and the 15 milligrams of zinc. This is important. Make sure your vitamin D level is above 85 nanomoles per liter, but not above 140. Most people are going to need, in addition to the 1,000 IUs of vitamin D in our multivitamin, at least another 1,000, maybe 2,000 IUs of additional vitamin D to get there if you live in this part of the world, from October to May especially. After the age of 40, the Adëeva Prostate 40 Plus product it's mandatory. It's mandatory. I've taken men that have had benign prostatic hyperplasia, even prostate cancer, given them specific recommendations, but included this product, very often been able to bring the PSA level down. But you don't want the PSA to rise in the first place. You want to protect your prostate gland beginning at age 40, 2 capsules a day. Just do it. It's the Cadillac product. I made it for myself because my own family history is so extreme in terms of prostate cancer risk. We make a product called Body Burn as well that has the green tea catechins in it. that have been shown to be very protective. So if you're not drinking enough green tea every day, this is the thing that you might want to consider. And our Adeeva Sleeping Naturals after the age of 45 has melatonin and some other things that help to improve sleep. We'll look at that in a second. So here's the multivitamin, right, with all the antioxidants. Dean Ornish used these ones. Here's the zinc, here's the vitamin D, also the B complex, 50 milligrams of each. There's, calcium for bones, all the bioflavonoids. This is a Cadillac multivitamin that saves your patients a lot. They don't have to buy antioxidants separate, a B50 complex here, a multiple vitamin there. It's all in one. It's like 8 different bottles of things all into one product for like, a little more than $1 a day. You have everything you need. And that, of course, is the breakdown of all the different nutrients in the multi, including the B50 complex. And it continues on this page. Then there's Adeeva's Nature's Essential Oils with flaxseed, borage seed, and fish oil to slow down the rate of cell division, the anti-inflammatory effect, slow down the rate of cell division by forming prostaglandins to slow things down. And here's Prostate 40 plus. After the age of 40, I strongly suggest you take 2 capsules a day. The dosage that have been used in all the clinical studies to show it can reverse mild to moderate benign prostatic hyperplasia, but has all those other protective effects, not only blocking the 5-alpha reductase enzyme, but all the other things that we looked at earlier. This is Adëeva Body Burn. It has the green tea catechins. You get a great dose of the epigallocatechin gallate. But remember that the chromium also sensitizes your insulin receptors, so you can help to keep your blood glucose lower. The Garcinia cambogia helps to block the conversion of carbohydrates into fat. So as you get older, this is a nice little product to help keep your body fat down and keep your insulin and your hemoglobin A1C lower and get the green tea catechin benefits, where it upregulates brown fat, so you burn more calories at rest and give it off as heat to the environment, so it helps keep your body fat down. But the green tea has these great anti-cancer properties and also brain protective effects, as you likely know. And here's Sleepy Naturals. It has that melatonin level, along with 5-HTP, which of course is going to help you make more serotonin and a bit more melatonin, but it's also mood elevating. The GABA that helps to get you to sleep, because melatonin puts you in a deep sleep, but first you have to get to sleep. And Bacopa monnieri has a great antioxidant effect, protecting the brain from free radical damage as you get older. So as you get older, you take higher doses because your melatonin level is dropping. So early, when you're 40 to 49, you just might need 1 capsule, but from age 50 to 60, you might take 2, and then you might take 3 as you get older. After age 75, you might take 4, 90 minutes before you go to sleep. So that is my presentation for today. I want to thank you for sitting in. This whole area of nutritional medicine and prostate health is very much ignored in the conventional medical world. I don't know why, but you really are charged with the task, in my view, of helping to educate your male patients, your male friends, your male relatives on the importance of nutrition and lifestyle as it affects the prostate gland. The prostate gland is very, very sensitive to nutrition and lifestyle factors. We need to make people aware of that. Men need to get that PSA blood test done to look what their PSA levels are, to get that kind of medical screening and medical treatment if and when it's necessary. But critically important are all these proactive lifestyle things that are just sort of been pushed to the side, where the evidence is very, very strong to show they can be highly efficacious in protecting the prostate gland, reversing some early stage problems, and being used in a complementary management application in conjunction with good medical practices. So thanks for sitting in today. If you have any questions, please